Yeah, it's basically all about how data gets used in health research.
So really, like, how do researchers actually make those big medical discoveries or decide on important public health policies?
Exactly. Every decision in health, whether it's about a new drug or understanding how a disease spreads, it all starts with data.
Okay, so we've got this really interesting PDF from Dr. Hamdi Alhakimi, and it's kind of like a guide to biostatistics.
Right.
And right away, I got kind of hooked on this idea of the difference between causation and association.
Yeah, that's a big one.
It's like that whole correlation doesn't equal causation thing.
Yeah, absolutely. It's easy to think, oh, these two things happen together, one must cause the other. But in health research, it's often not that simple.
Can you give us like a medical example of that?
Sure. Think about this. Studies have shown that people who drink coffee regularly actually have a lower risk of Parkinson's disease. But that doesn't necessarily mean that the coffee is preventing Parkinson's. There could be other things going on, like maybe those people have certain lifestyle choices or even different genes that could be connected to both how much coffee they drink and their risk of Parkinson's.
So just because two things are linked doesn't mean one is causing the other. Researchers have to like dig a lot deeper.
Right. That's where you need really well-designed studies.
Like what?
Things like randomized controlled trials, where you randomly assign people to different groups to really try to isolate the effects of a specific intervention, see if it truly causes something to happen.
Makes sense. So this PDF also goes into all the different types of data used in biostatistics.
Hmm.
And some of it seems pretty straightforward, like, numerical data like age, blood pressure, cholesterol level, stuff like that.
Sure.
But then there's also this thing called categorical data. And that sounds kind of more complicated.
Oh, it's not as complicated as it sounds. It's basically just a way of organizing information into, well, categories. Oh, okay.
So it's information that isn't numerical.
So could you give us a few medical examples?
Yeah, think of something like blood type, A, B, and O.
Right.
Or stages of cancer, stage 1, stage 2, and so on. Those are all categorical.
So it's kind of like putting information into neat little boxes to make it easier to understand.
Exactly.
Yeah.
And to make sense of it all, especially with these huge data sets, researchers use a process called coding.
Okay, now this is where things get interesting. I was reading about this in the document, and it sounds like coding is almost like creating a secret language that only computers can understand.
Huh. It's a good way to think about it.
Mm.
Computers are really good at dealing with numbers,
Right.
but they have a harder time with words or categories.
Mm.
So researchers actually assign numerical values to those categories.
Okay.
For example, male might be coded as 0, female as 1, or smoker as 1, non-smoker as 0.
Oh, so it's like translating all that complex info into a simpler code that computers can easily process. You got it. And that coding process is super important because it makes it possible to analyze huge amounts of data in a standardized way.
That makes a lot of sense. But even with really careful coding, there's always the chance for errors to, like, sneak into the data.
Oh, for sure.
And that's where this whole data cleaning thing comes in, right?
Absolutely. Data cleaning is all about, well, it's almost like detective work. You have to carefully examine the data, looking for any little inconsistencies, errors, outliers, anything that could mess up your results.
So, like, if you were looking at patient data and you saw an age listed as, like, 200 years old.
Exactly. That would be a pretty big red flag.
Yeah.
So data cleaning would involve finding those errors and fixing them. Sometimes it could be just a simple typo, or a mistake when the data was entered. Sometimes it's even a problem with the actual measuring instrument itself.
Gotcha. So it's all about making sure the data is as accurate and reliable as possible.
Right, because if the data is flawed, then any conclusions you draw from it are going to be questionable too. Think about it. You wouldn't want a doctor to make a diagnosis based on inaccurate lab results.
No, definitely not.
And that actually reminds me of something else from the PDF, something called descriptive statistics.
Okay, what are those?
So descriptive statistics are basically tools that help us summarize and describe the main features of a data set.
Got it.
So imagine you've got this massive spreadsheet with thousands of rows of data descriptive statistics. Help us make sense of all that information by giving us some key insights.
So instead of drowning in a sea of numbers, we can get like a quick snapshot of what's going on.
Exactly. We can calculate things like the average age of the participants in a study, or maybe the proportion of patients who responded well to a certain treatment.
And that helps researchers see like the overall trends in the data.
Precisely. It's kind of like getting a bird's eye view of the data landscape.
I like that.
painting a picture with numbers.
This is all really fascinating stuff. And it makes you realize how much work goes into making sense of data before researchers can even start drawing any conclusions.
You're telling me data analysis is a really meticulous process, and it all begins with understanding these foundational things, the different types of data, coding, cleaning, and those descriptive statistics. Those are the building blocks of any reliable health research.
Okay, so we've covered those descriptive statistics, the ones that give us a basic understanding of what's in the data.
Right.
But then the document goes on to this other thing called inferential statistics. So what's the difference between those two?
Good question. Descriptive statistics, like we've talked about, just summarize the data you actually have. But with inferential statistics, you can actually go further and make predictions or even draw conclusions about a much larger population based on just a smaller sample.
Oh, so it's kind of like taking a small snapshot and then using it to understand this, like, bigger picture.
Exactly. Think of it this way. Let's say researchers are testing out a new drug for high blood pressure. They might do a study with just a few hundred people. But then inferential statistics can let them take the results from that smaller study and generalize them to a much larger population of people with high blood pressure.
Wow, that sounds really powerful, but also kind of tricky. Like, how can you be sure that what you find in a small group is actually going to apply to, like, a whole bunch of other people?
Yeah, that's where things like good sampling methods and this idea of statistical significance come in.
Okay.
So researchers have to be very careful about choosing their study participants. You want to make sure they're really representative of that larger group you're interested in.
Right.
And they use all kinds of statistical tests to figure out whether their results are probably due to a real effect or just kind of a random fluke.
So it's not just about crunching the numbers. There's a lot of, like, careful planning and analysis that goes into it, too.
Absolutely. Inferential statistics can be super useful, but you have to use them responsibly and understand, all those basic principles.
So the document also mentioned a few different types of descriptive statistics, like proportions, rates, and ratios. Can you break those down for us a bit?
Sure. Let's start with proportions. Basically, a proportion just tells you what fraction of a group has a certain characteristic. For example, you might look at the proportion of patients in a study who have side effects from a new medication.
So, like, if 20 out of 100 patients have side effects, that proportion would be 20%.
You got it. Now, a rate is kind of similar to a proportion, but it usually involves some measure of time, too.
Okay.
A common example in healthcare would be like a mortality rate. That tells you how many deaths occur for every, say, 100,000 people per year, and from a specific cause.
I can see how understanding rates would be really important for things like tracking, disease outbreaks, or see if public health interventions are working.
Absolutely. And then you have ratios, which are basically just a way to compare two quantities. So in healthcare, you might see this with like the ratio of men to women who are diagnosed with a particular disease, or maybe the ratio of patients who respond to a treatment compared to those who don't.
So all these things, proportions, rates, ratios, it's all about figuring out the relationships between different pieces of the data, right?
Yeah, you could say that. It's about putting the numbers into context.
Makes sense.
Hmm.
Now, the document also kind of briefly mentions these measures of central tendency and measures of dispersion. Can you explain what those are and why they're so important?
Sure. Measures of central tendency are all about figuring out what the typical or average value is in a data set. The most common ones you'll see are the mean, median, and mode.
Okay.
So the mean is what most people just call the average. You add up all the values, then divide by how many values there are. The median is that middle value when you put all the data in order. And the mode is just the value that shows up the most.
So what if we were looking at the ages of the patients in the study? The mean would be like the average age. The median would be that age that splits the group in half, and the mode would be the age that shows up most often.
You got it. And now, measures of dispersion, those tell you about how spread out the data is. One of the most common ones is the standard deviation, which tells you how much the individual values in that data set kind of stray from the mean.
So if you have a large standard deviation, that means your data is more spread out.
Right.
And a small standard deviation would mean it's more clustered around that average.
Exactly. So let's say you're studying how well a blood pressure medication is working. If you see a large standard deviation, that might tell you that the medication's having different effects on different people.
So it's not just about the average response, it's about understanding the whole range of responses too.
Precisely. And these measures of central tendency and dispersion give us a much more detailed picture of the data than just looking at the average alone.
Right. So I know that data visualization is also a super important part of biostatistics. Can you talk about why using visuals is so helpful for understanding and communicating data?
Oh, yeah. Visuals are really powerful. They can help you see patterns and trends that you might completely miss if you're just staring at rows of numbers in a spreadsheet.
Right.
Imagine trying to make sense of like hundreds of blood pressure readings. If you just have the numbers, it'd be really hard to get a good grasp of the trends, right?
Yeah, that's true. It's like they say, a picture is worth 1,000 words.
Exactly. And there are different types of graphs that work best for different things. Bar graphs are great for comparing categories, like maybe the prevalence of different types of cancer. Histograms show you the distribution of numerical data.
Uh-huh.
So things like the range of blood glucose levels in a group of patients. Scatter plots are good for seeing the relationship between two variables, so you could see how age and blood pressure relate to each other. And pie charts are useful for looking at proportions, like what percentage of patients responded well to a treatment.
It sounds like choosing the right type of visual can really make the data come alive.
It definitely can. And data visualization isn't just for researchers, It's for anyone who wants to understand or communicate data more clearly. So even if you're just reading a news article or presenting some data at work, or maybe even trying to understand your own health, data visuals can help make it all make more sense.
So we've talked about descriptive and inferential statistics, the different types of data, coding, data cleaning, even data visualization. Is there anything we've missed?
Well, we've really just scratched the surface here. There's a whole universe of statistical techniques and methods out there, each with their own specific uses and little quirks.
I'm realizing now that biostatistics is a lot more than just, crunching numbers. It's about asking the right questions, choosing the right tools, and then interpreting the results really carefully.
Yeah, that's a great way to put it. It's this cool mix of scientific rigor, mathematical precision, and really deep knowledge of whatever subject you're looking at. And when it's done well, it can lead to some incredible breakthroughs in how we understand health and disease.
This has been such a fascinating deep dive. Before we go any further, I'm just curious, what are some of the common pitfalls or misconceptions people have about biostatistics?
Well, one that I hear a lot is that statistics can be manipulated to prove anything.
Yeah, I've heard that one too.
And while it's true that people can misuse or misinterpret statistics, ethical researchers are really committed to using those rigorous methods and being transparent about how they report their findings.
Okay.
Another pitfall is overgeneralizing results. Just because you find a correlation in one study, it doesn't automatically mean one thing causes the other, or that you can just apply those findings to everyone.
That makes sense.
And the last thing is, you always have to remember that statistics are really just one piece of the puzzle. You need to consider them alongside other forms of evidence, like what do the experts in the field say, and what do patients themselves think and value.
Those are all really good points to keep in mind. It sounds like it's always good to have a little healthy skepticism when you're trying to make sense of statistical findings.
Oh, absolutely. Always check where the information's coming from. Think critically about the methods they use and be careful about any claims that sound a little too good to be true.
So what would you say is the main takeaway for our listeners today?
I think the big thing is this. Understanding just the basics of biostatistics can help you become a much more informed consumer of health information. It can help you critically evaluate research findings, make more informed decisions about your own health, and even advocate for policies that are based on good evidence.
That's a great point. This has been such an insightful deep dive into the world of biostatistics.
Yeah.
It's like we've gotten this backstage pass to the world of health research.
Totally.
And speaking of tools, this PDF we've been talking about mentions a program called R.
Mm-hmm.
It's a statistical analysis program. What's the deal with that?
Oh, R. It's a pretty amazing tool. A lot of researchers use it for data analysis. You see it everywhere in universities, companies, and there's this huge community of people who use it and are always coming up with new add-ons and resources for it.
So it's like a secret weapon for statisticians.
You could say that. R lets you do tons of different analyses, from basic stuff like descriptive statistics to more complex things like modeling and even machine learning. And the best part, it's open source. Anyone can use it for free.
Wow, that's really cool. It sounds like learning R could be really valuable for, well, Anyone who deals with data, not just people in healthcare.
Oh, absolutely. Data is everywhere these days. So even just a basic understanding of how to do some statistical programming can give you a real edge. And there's so much good stuff online to help you learn, even if you've never coded before.
Maybe that's a deep dive for another time, learning R.
I'm in. But before we totally wrap up our biostatistics deep dive, I do want to touch on one more really important thing.
Okay.
The ethical side of using data, especially in health research.
Yeah, that's crucial. We haven't really talked about that yet. What are some of the key ethical things researchers need to be thinking about?
Well, the biggest one is protecting patient privacy. Researchers have to make sure that any personal information they collect is kept confidential and used only for the purpose of the study.
Right. Makes sense.
And informed consent is super important too.
Yeah.
Anyone participating in a study needs to understand all the risks and benefits before they agree to be a part of it. You can't just spring it on them.
So it's not just about collecting and analyzing data. It's also about doing it responsibly and ethically.
Exactly. And the research community is always talking about how to find that right balance. You know, the need to have data to make discoveries, but also protecting individual rights and privacy. It's a tough one. Like with all this big data and machine learning stuff popping up, there are a whole bunch of new ethical questions researchers have to grapple with. It's a constantly changing landscape.
It really sounds like it.
Yeah, and it's important for everyone to be a part of those conversations. Researchers, policymakers, and just everyday people, too, to make sure data is being used in a way that benefits everyone.
This has been such an eye-opening look at the world of biostatistics. I really feel like I get it now, how powerful data can be, but also how important it is to use it responsibly.
I'm glad to hear that. And, I hope our listeners feel like they can ask questions, think critically about the information they come across, and have those important conversations about what role data plays in our lives. Because in the end, it's not just about numbers, it's about using them to make people healthier and improve lives.
That's a great way to put it. Well, on that note, I think we're going to wrap up this deep dive. Thanks for joining us, everyone.